It's a new day in modern dentistry. You can feel like yourself again with Shatkin Mini Dental Implants. Mini Dental Implants are the safe, fast, and cost-effective solution to many dental issues. Do you suffer with loose dentures? Are you afraid to smile or unable to eat the foods you love because you have missing or broken teeth? Mini Dental Implants are your affordable solution.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
I'm John DeShulo. Welcome to Innovations in Health. We're talking about the mini dental implant, a procedure that will change your life. You can be you again. And I'm welcoming Dr. Aaron Bratton from Atkins Dental Clinic, 406 North Church Street, Suite 4149 in Atkins, Arkansas. We're going to get to know Dr. Bratton in just a little bit and find out all about what Dr. Aaron does at his practice. But first, friends, we want to tell you about the mini dental implant. It's 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. And folks, if you are anywhere from Little Rock to Clarksville, Russellville, Fort Smith, we're serving all of that area, including Conway as well, all from the Atkins Dental Clinic in Atkins, Arkansas. And the mini dental implant is FDA approved. It's a made in America product. You can be you again if you have dentures that are not stable. They're falling out. You don't taste the foods that you like. Imagine biting into an ear of corn without fear of your dentures falling out. Biting into a juicy steak. And of course, fried pickles and possum pie, all the great tastes of the food that we love in Arkansas is all going to be coming back with the mini dental implant. Dr. Aaron, welcome to the show.
Thank you, John.
And we set it up by saying that this is going to change your life, but it is a radically different procedure than a conventional implant. Show us with that mandible example, Dr. Aaron, the difference between a mini and a conventional implant.
Well, first off, it's in the name. What you can see with your eyes clearly on the mandible. Over here, this is the standard diameter implant and the mini diameter implant prep hole that is made. And the reason we're able to say less invasive is we make much less invasion into your bone to place the root replacement as the implant. There's less healing time because obviously there's less space that the body then has to repair after the preparation for the implant. And then it's also less expensive. If you have less materials you're using to create something, the manufacturer charges less to make it.
And with the conventional implant, it certainly is a larger hole, but there's bone grafting that needs to take place, and there's an extended period of time for healing before that implant can even be made into the bone.
Quite often, yes, that is the case. With the mini diameter implant, we are very often able to take advantage of the bone that's already present without having to do any reinforcing or bulking of the area, as John had put.
And same day, in your office?
Yeah, same day. Very rarely do we have to do any delayed, as we say, loading of the implant, whereas with the standard implant, your average least healing time is roughly 3 months, and then an average to 6 months. So we're able to get you back to where you want to be much faster with much less discomfort as well.
Now we're going to talk about some of those dentures. So if you have a denture and it's a lower and it's swimming around on the bottom of your gums, look at how the mini dental implant will stabilize your lower denture.
In my neck of the woods, that type of denture often gets referred to as a pocket denture, and it gets put in for pictures. People cannot function when the denture is just rolling around between all the tissue because the bone is so far gone. But this is what made the reputation of the mini implant, is this procedure right here. Was due to there being so little bone, the standard implant could not fit just because of how big it was. But the mini implant can come in with a ridge as thin as that and be able to provide substantive structure and support. Whereas that goes in, and I've got some pretty good grip strength, and I have to struggle to get that to release off those 4 implants. You can see here the configuration and shape of the implant is kind of like a trailer ball hitch with a little square base. That O-ball configuration goes up into the housings we place into the denture, where there is a rubber or linol gasket that goes in, and that is what provides you that stability. The goop that just kind of helps you keep that type of denture in is no longer something that's necessary at all. One of the first sets of these I placed in a patient was an individual who had been in a set of dentures for 15 to 20 years, and they had a severely shrunk mandible. The height you see on this model is actually way more than what he had present, which also goes to show how well these can be placed in a tight area. But he came in, we did the assessment, was able to retrofit his current denture to the implants we were going to place. One appointment, he came in for his 24-hour check and said, "Doc, I've taken a half a pain pill that you prescribed me yesterday. I haven't needed them today, and it's the first time I've eaten peanuts in 7 years." And these, I mean, it's, as you said, changed his life.
Changed his life. Imagine not enjoying the foods that you love and all of the things that it does to your body, because you're not getting all the nutrients and you're not doing the things that you want to do as a person. And no matter what your age, if you have a denture, why live out the rest of your life without enjoying peanuts? Because the upper denture, this is where you're going to see the exposure of the palate. And now those tastes of hot and cold and sweet and sour are going to come back.
Most individuals, if they've got a lower denture, more than likely, they also have an upper denture. Many individuals are blessed with the capacity to tolerate one of these, but when it comes to doing something that's life-changing for you, toleration is not the goal. We're looking to make it something that you no longer think about, you no longer have to make concessions for. If you're someone like me, and when you laugh loudly and proudly, you run the risk of projecting a little more than you intended to if you don't have the mini implant system as, you know, a part of you. And as you can see, that's also just as tight as the bottom. There are some small differences. We have to do a few more implants, and that's just due to the shape of your anatomy. But as John said, we don't have to take over all the real estate of your mouth for stability anymore. We re-expose your palate, which aids greatly in your ability to taste and feel the sensations of your hot coffee or the ice cream. But if you are an individual who has ended up in the position of having to have an upper denture, but you also are cursed with a highly sensitive gag reflex, that's gone. You are no longer having to make the decision of, well, do I wear my teeth today and feel like I'm sick, about to vomit, or am I going to be comfortable but toothless? We give you your life back.
Now, if you're a denture wearer, Dr. Bratton will help you make a denture if you need one, right?
Correct. As I mentioned before, we often are able to retrofit an existing denture, but if it's not possible due to the lack of space, because we have to mount the housings and such, we do create a new denture for you that is custom made and fitted to the implants that will be placed. And that is still a one appointment process in terms of delivery of denture and implant placement. That will all be done the same day. Now, there will be appointments to fabricate the denture, but when it comes in, implants are placed, dentures are placed on the implants, all in one time.
We're going to show you now what's called the fixed on 6, which is almost like a full set of teeth.
It can be as full as we need it to be, but its claim to fame is this is as close as we can get to giving you the full real estate of your mouth back with an appliance. And it's in the name. It's fixed upon 6 different mini implants across there. It is removable. There are 2 different types that we can make in terms of the removable. There's the type that is similar to the denture in so much that it is the same gasket. Then there's a much sturdier version of said gasket where it is designed for me to remove during your general implant maintenance and just kind of recall appointments.
Now we're going to move it up a level. We're going to call the roundhouse. This is a permanent solution with the mini dental implant procedure. Take a look at this.
For all intents and purposes, it has the same amount of real estate that's brought back to your mouth, but the big difference between it and the Fix on 6 is there are quite a few more implants, but when you think about, as he said, our God-given teeth, each of those teeth have a root. These are the replaced roots for all of the teeth that you have lost. But the difference between here, the biggest difference, this doesn't come in and out. When you come into my office to have this put in with the implants, it is cemented into place as you would have a permanent crown or bridge cemented in. There's no removing this. You don't take it out at home. I don't take it out when you come in for maintenance. It's there.
We should mention, Dr. Aaron, these are made in America products.
Yep, all of it.
And this is a porcelain product, so it's made to take a licking and keep on ticking, as they used to say in an old TV commercial. And that's important to note because it's FDA approved, it's made in America, it's custom designed just for you. Say, for instance, you have teeth that are in the back of your mouth and you've lost them. There was a problem. And some people adhere to that old adage, out of sight, out of mind. They don't let it happen anymore.
It doesn't hurt, so I don't got to do anything about it.
Yeah, but those back teeth are very important for the chewing capacity to get the nutrients out in the food. But let's show those side teeth, Doc.
Absolutely.
To show what that mini dental implant can do to solve that problem.
So a lot of individuals, before they get to the point of needing a denture, often are using a partial denture. And a partial denture, you know, it's in the name, it partially replaces your teeth. Well, we can, once again, give you your natural mouth space back, get rid of the bar that goes across the roof of your mouth, that taste of metal that the partial brings with it, where you're missing a span through the back. We, as we did with anything that's fixed, you kind of think we're got to replace the roots because that's going to be taking a lot more of the forces during function. So each root gets replaced across that area for the teeth that were removed at whatever point in our life. This goes in, is cemented into place, and it becomes, part of you.
It's not just something for cosmetic sake. This is a real form and function.
Absolutely. Yeah, most folks don't think about the fact that your teeth are not static. They are trying to move, compensate, adapt to changes, and a big change is a lost tooth. And that does, not just can. If one tooth is drifting and the tooth that it's partnered with from below, it starts hitting differently, you're inviting a cracked tooth to occur, you're inviting more problems downstream where we can get you a solution that feels like you never lost anything.
And if you have a tooth that's missing, the mini dental implant will fix that, and not just with a standard rip it out of a box and put it in your mouth flipper. This is something that's custom designed just for you, made in America. With
the level of customization that we accomplish with this system and in the prosthetics that we create, I often invite my patients during the fabrication process to bring pictures of their old smile. I mean, I've had old Polaroids from the 70s show up in my clinic that were clear enough, and we go, that's great. I send them to my specialists in my shack and laboratories, and the patient gets to see in the mirror their old selves. So we can make you again. You just tell us when. You want to look your best, and you can. Dr. Aaron Bratton and his team at Atkins Dental Clinic, 406 North Church Street, Suite 4149 in Atkins, Arkansas. Here's the number. It's on your screen, but we're going to tell you just so you can write it down and make the call. It's area code 479-662-0991. And as we said, the office is located, at I-40, right at the start of the Ozarks. Basically, yeah. Yes. The website, it's not a mistake, folks. It's for real. mustachioedds.com. And you can't deny, Dr. Aaron, that you have a mustache that's worth discussing. Well, thank you, John. This is a big piece of the branding, isn't it? Yeah, I was forced to grow a beard because I have a little bit of a baby face. When I first graduated, I was very clean shaven, but I was referred to as boy, Sonny, and about everything but doctor, and I had enough after about 6 months. So I started growing a beard, and just overnight, I became Dr. Bratton. And since then, I've leaned pretty heavily into having, a look. All right, so let's get to know you, Dr. Aaron. We talked about the minis and the whole reason why that's going to be such a life-changing dental procedure, but tell us about you. Where did you grow up? Well, I was born just down the road in Russellville at St. Mary's, and grew up here in Atkins. I've moved 2 times in my life, south of town and then north of town. Played baseball, probably with some of you who are watching right now, and we did our canoe racing here in the community with the venture crew, basically Boy Scouts. Went to college just down the road, Arkansas Tech, followed my dad to University of Oklahoma College of Dentistry, and then came back here. Yeah, and your dad was a dentist as well. Well, technically, I guess this year he retired, but it's still in my mind, is a dentist. Yeah, I guess when you're a dentist, you're always a dentist, right? Yeah. But you had to take over for his practice a little earlier than you had anticipated. Yeah, he did start Atkins Dental Clinic in 1987, a year before I was born, and I got to take over the helm in 2014, roughly 9 months after I graduated. The plan was to have him keep the helm and, me be first mate and learn the ropes and tricks of the trade, but he did have a massive heart attack, which expedited his retirement. So I got to take over a little early and learn things, a lot of it the hard way. What's he think of the mini dental implants? He's actually the one who introduced me to him. It was one of the first clinical continuing education courses that he had me take outside of learning how to perform sedation. And so I have been placing the mini implants in the lower mandible for roughly 10 years now.
Tell us about your family. So you're married and you're, I guess, a big animal lover.
Been married for 5 years. Yeah, grew up with animals, grew up on a farm. My wife, however, we joke, but it's not a joke, it's serious. She's a professional coddler of all things furry, feathered, or otherwise. And now we also have chickens. She's got about 12 of those. We have a parrot, a little sun conure. Her name's Sunna.
So animal lovers that are out there, Dr. Aaron is your dentist. And you know, if you're seeing another dentist right now and you're looking to maybe make a change, Dr. Aaron, I understand you do all kinds of dentistry as well, including cosmetic dentistry.
Yes, my father's philosophy was to be a one-stop shop for his community, because when he came to Atkins, you know, almost 40 years ago now, there were very few specialists in our area of Arkansas. So we offer everything from oral surgery of wisdom tooth removal, bone reduction. If you've had a denture, you may have heard the word tori. We offer orthodontics. We do endodontics, which is a root canal, full mouth rehab. We try and do most of everything and save what's truly, truly difficult for the specialists, because, you know, they got to work too.
You know, the other thing that you offer is a consultation using what's called the cone beam. Affords you the opportunity to look at that patient and in a three-dimensional way see where that implant's going to go.
I never knew how blind I was working as a dentist until I got a cone beam x-ray. It's like I'm holding their skull on the screen and can turn it around and put upside down, see how dense, even dense the bone is, not just the dimensions of it spatially. It truly is almost a level of sci-fi tech in terms of what we can see inside of you.
And it's the latest technology, and it's available right here in Arkansas, so it's not that far from wherever you are. And with a consultation, talk to us about how that works.
So the consultation, you come in, I do just a clinical in the chair, look at the gums, just see what we're working with and what you've brought us. The consultation then will proceed to the cone beam, as we had just mentioned. From there, see what bone's looking like, make sure there's no pathologies that we wouldn't be aware of. And more or less, I'm able to tell you at that point whether we're going to be a good candidate. That image is then sent up to Buffalo for the laboratory to do their assessment and planning of where implants will go and fabrication of stent. If we are not making a new denture, our next appointment is placement of your implants.
And if you come in for the consultation and then you get dental work, the consultation fee is waived.
Yes, if you're coming in to, you know, you chipped a tooth, did whatever, it's not necessarily just for the implants, because that'd be pretty cool though if we could. Yeah, fee is waived if we do same-day treatment.
We've talked a lot about the mini dental implant and how it's going to change your life. Let's hear from some of the patients now who have experienced what the mini dental implant has done to change their life. Take a look.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
This is something that is so incredible.
I feel a lot more confident, my smile feels better.
And it brought a lot of confidence back to me.
It's just amazing what it does for your self-confidence and how you feel about yourself.
After the procedure, wow. Yeah, you smile.
I am very happy I had the procedure done. I feel as though I have my smile back.
It's just unbelievable what it's done to my life.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Changed my life.
And all those folks had their life change at Atkins Dental Clinic. Dr. Aaron Bratton, that's who we're talking to on Innovations in Health. He's located at 406 North Church Street in Atkins, Arkansas. You can call him at 479-662-0991. That famous website that's going to go down in the annals of internet history, mustachioeddds.com. And if you're in Conway, Fort Smith, Clarksville, Russellville, Little Rock, or you're listening from anywhere here in the great state of Arkansas, go to see Dr. Aaron Bratton. And you know why? Because some of these Google reviews, I'm reading them right off the web. Lisa says, "This doctor is great. So friendly yet professional. He understands my fear, works with me on it. The employees are so sweet. Patty, very friendly. Great work. Love this dentist." Connie, "Dr. Aaron has done a terrific job on my front teeth. I don't think they have ever looked so pretty." And there's another one from Hunter who says, "Kind, patient, attentive, and professional. I was terrified going into my appointment, but they were very sure to make sure that I was as comfy as I could possibly be. I will definitely be using this service for the foreseeable future." And, you know, Hunter brings up a good point. Some people have a fear of just going to the dentist, but you do something for the patient if they really do need to be sedated. How do you work with the patient in that respect?
So we offer several options in terms of depth of sedation. But what a lot of phobic individuals really require is just to not be there in terms of being conscious of what's happening. So we offer what's called conscious sedation. It's in the name. We take the part of you that thinks, remembers, experiences, and most importantly fears, and we turn it off. That's typically performed through a medication called Ativan. There are some others that I will utilize depending on case-by-case basis, but we mix that with the nitrous oxide, the laughing gas, if you will, and it puts the patient to a state of sleepwalk. The part of you that's afraid, you're in dreamland.
What do you prescribe for the patient to alleviate whatever little pain there may be?
The main workhorse pain medication in dentistry is hydrocodone with acetaminophen or Tylenol. And I typically do prescription, well, not typically, always, unless there's an allergy, of pain medicine with the mini implant procedure. Most of the time, I am told by my patients, they don't really need it after the fact. And even so, I would rather them have it and not need it than need it and not have it.
And that's why the mini dental implant is so important. It's 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist. Not that you don't want to go in and see Dr. Aaron and his team. And it's less expensive. And I use a water flosser every day. That's probably a good piece for somebody who has a mini dental implant to use for dental hygiene as well.
Absolutely, especially with either the fixed on 6 or the cemented roundhouse. The water flosser is about the only option you have that will get in there with any kind of sufficient hygiene quality.
Let's talk about the models. You know, folks, we're talking to Dr. Aaron Bratton from Atkins Dental Clinic. Now, if you just joined us, we're talking about the mini dental implant. If you've been with us for the half hour, you saw this a little earlier in the program, but we want to show it to you again because this really brings home the significance of how the mini will change your life. So if you have a lower denture and it's swimming around on the bottom of your gums, and I know all of you out there who have dentures have experienced that. My mom did, lived with it all her life, but she didn't need to, because the mini dental implant will stabilize this denture. Take a look.
This has a lot more ridge than what a floater would have, but the ridge becomes irrelevant when you have the mini implants giving you that level of security. Between the gasket, the O-ball configuration, goop is gone.
And that snap right there.
Right there.
You hear it
every time.
Now, if you have a lower, odds are you have an upper. But again, the foods that we love, all that great taste is back because the palate is exposed with the upper denture example.
That's right, John. With the security being, offset or set up on the implants, your need for glue is offset. The need of the palate to form the suction for your upper denture is no longer necessary at all. So we're able to cut all of that out or make it without it there. If we're retrofitting an old denture, I will cut the palate out at placement to where we give you this outcome even with just your old denture. But even more important, for a lot of individuals with an upper denture, they're dealing with a gag reflex.
You have a patient that experienced that.
Oh, absolutely.
And it's gone now.
She came in and we had to put her in immediate dentures and was not able to do the same day implant and denture placement due to the fact we had to extract teeth and allow those spaces to heal. Her 6 to 8 months experience of tolerating her denture and trying to find the fine line between function and not gagging was miserable for everybody involved. But the day we came in and put her implants in, mounted her denture and cut the palate out, I mean, we flipped a switch in her life to where she goes, this is what I've been waiting for, and this was worth it.
And you out there who are experiencing that pain and that discomfort, you can have your life changed with Dr. Aaron. Let's take a look at what we call the fixed on 6, because this is like a full set of teeth.
Yes, it's as full set of teeth, but also feels as much as like your natural teeth as we can do with the mini implants and with the laboratories up in Buffalo. As you can see, there is no palate whatsoever, no extension, there's no flanges that go up between your gums and your cheeks. It is all set directly upon your true gums. And in the name, fixed on 6, it has 6 implants, just as the denture would. So we can transfer you from an upper denture to a fixed on 6 by just making the appliance for the patient. It has the same sort of gaskets, the same level of stability, and it's a different material. This is actually a porcelain product versus the acrylic and plastic of a denture. So we're able to get a little bit more of that natural luster that the Hollywood sparkle.
It's a step up, and then if you want a permanent solution, the roundhouse example is for you.
Just as the Fixed on 6, it is another porcelain product. We do have to use more implants for it, but if you think about something that is going to be fixed to you just as your natural teeth were, each of your teeth have a root, each of the teeth on the appliance needs a root, but there is no gasket involved. It is cemented into place with dental cement permanently.
Now, if you have teeth that are in the back of your mouth and they're missing, you can't ignore that. These are the teeth that chew the food, get the nutrients, create that workforce that is so important. And if you're missing those teeth, the mini dental implant procedure will put them back.
And if you've been missing those back teeth and you've been having to deal with a partial denture, well, you've got that metal strap across your mouth. A lot of patients can taste that metal. So we can give you back even that minute amount of lost real estate that a partial takes up comparative to a full denture. But just like with the roundhouse, we replace every missing root. It cements in place. It gives you your full function back. It gives you your facial dynamics and dimensions back, all without having something that's in there that doesn't feel like you. And that's the beauty of anything that we get to place and cement in. It becomes part of you, and all my patients have forgotten that we've done the procedure half the time.
And if you're missing a tooth, take a look at this.
Whether you're replacing multiple teeth, all your teeth, or just one tooth, which this one's an anterior. I've done several anteriors. I've done several just single back teeth, but it's the same concept. It allows for a very tight space to be filled. We fabricate the crown, and we will custom make this in terms of matching the color of your adjacent teeth and, of course, the shape, contour. And we cement it into place, and no one's ever the wiser that you were ever missing a tooth.
All with Dr. Aaron Bratton at Atkins Dental Clinic, 406 North Church Street, Suite 4149 in Atkins, Arkansas. The number 479-662-0991, and of course, mustachiodds.com. Dr. Aaron, what gives you great joy in being a dentist?
When I was in dental school my junior year, I was going through my removable prosthodontics, which is just dental speak for denture course. And I got to meet a woman who'd been without her teeth for 8 months during the healing process, which was standard, and we try and get away from that now as a practice. But the day I got to put her teeth back into her life, seeing her look at the mirror and smile again, and just seeing her joy, I mean, she started crying, I started crying. It was one of the most beautiful things I had ever facilitated in my life up to that point. And now, having practiced dentistry for coming up on 12 years, I've got to repeat that experience with multiple people, multiple times, over and over again. And every time it's still as impactful for me. And it's as much headaches comes with being a small business owner, and as much headache comes with dealing with people's fear and having to guide them through that and everything else with dentistry. If I was given an opportunity to do something different somewhere else, something else, it would not measure up to that in terms of seeing someone and facilitating seeing someone, their view of their future change with my skill set I've been blessed to achieve.
Well, you've been blessed, and you're helping people here in Arkansas, and you are an innovator in health, and it's been an honor to meet you, Dr. Aaron Bratton. So thank you for joining us.
Absolutely, John.
Thank you, and thank you for watching.